And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. On your day off, might I add, we appreciate
every day,
you
24/7. It's
my
my pleasure.
I understand.
I love doing this.
It's the news in the medical business.
Absolutely.
That's what we do. Our first question, my mother recently had a massive stroke and is stage 4 cancer in a hospice center. What can we do to feed her? She can swallow. She refuses a feeding tube, and she can't do the stomach tube due to the tumors and the colostomy. We are trying syringes of Ensure, but it hasn't been real successful.
You know, there's not a whole lot to do in this situation. It is very unfortunate. Stage 4 cancer plus a massive stroke, 2 illnesses that typically are irrecoverable or unrecoverable from a patient, typically what we call a terminal event, meaning the medical community just doesn't have anything else to offer this patient, and you can continue to feed this patient as possible, but again, it doesn't do anything for the stroke, it doesn't do anything for the cancer, and it typically is something that we recommend for patients who have terminal illnesses. It's very difficult for the patients, I should say the family, to look at that and see that. They think they're killing the patient, they think the patient's dying from starvation, but you have to have a long conversation with them as well as getting the hospice team in order to try and educate them about the dying process and actually what they're dying from. In this particular case, stage 4 cancer and a massive stroke. That's what's caused the disability. We can't fix it, and there's no reason to feed them because you cannot fix the stroke and the cancer. And so it is a good idea to try and maximize comfort and understand the dying process in the situation. So in my opinion, there's not a whole lot to do but keep them comfortable, work with the hospice service very closely.
Okay, another question regarding diabetes. There's been a lot of chatter on social media about alternative treatments claiming success in lowering blood sugar levels. Doesn't see a medical community weighing in on these alternative possibilities. Do you think there is validity to any of the natural treatments?
Without being specific in terms of this question, it's difficult to answer, but typically, no, those alternative measures do not have any validity in terms of physicians. We practice Western medicine. We believe in certain types of studies that dictate to us if this is a good result or a bad result. We read journals. We have societies that gather every year or two. They look at all the data out there and make recommendations every year or two, and that's what we go by, and this is the scientific process. So with the internet and the way it is with social media, there's so much information out there, misinformation a lot of times. Get with your primary care physician, your healthcare professional, have a one-on-one conversation about what's best for you because there's so much misinformation. That's why we recommend going to the office routinely to review what the latest guidelines are to make sure you're getting the right proper care.
Now, if you do decide to do one of these natural alternative treatments, is it best to tell your physician in addition to whatever they prescribe?
Yeah, absolutely. I mean, just one-on-one communication with them. A lot of people do decide to do something that's alternative, and I don't have a problem with that necessarily. It's their body, it's their health. I'm practicing a certain type of medicine, and I'm educating them. I feel like I'm just a health advisor, a health coach, if you will. It's up to them to decide what they want to do. It's not like it was back in the day where the physician told them what to do and they did it. It's more of a one-on-one relationship now. So absolutely tell your healthcare professional what you're doing so we know what's going on. Sometimes there's some interactions with the medications we're giving them, and we just want to be up to date with what you're doing and try to educate you on what's out there.
All right, we've got lots of other questions. We'll get to those in just a minute.
Yes,
so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says, I had white polyps on my colon about 10 years ago on my last colonoscopy. Since the polyps have possibly gotten worse, how do I find out?
Basically, 10 years seems to be a long time, especially if you've seen polyps. We normally recommend every 3 to 5 years, so this person is long overdue for a repeat colonoscopy. So certainly just get another colonoscopy and you'll be able to tell about that.
Okay. Another question. This person says, what would you do to treat a family member that's 3 years old with Dravet syndrome, knowing that a form of marijuana exists but can eliminate seizures and do not resuscitate orders overnight.
Yeah, you know, this issue is not going anywhere. We're going to hear more and more about medical marijuana as more states adopt that. Obviously, in Texas, it's still illegal. We still don't work with it. So I don't really have a whole lot to say about that, just because it's just not an option for me at this point. Again, we talk about Twitter and the social media. There's all sorts of information out there, Colorado, Washington. So a lot of doctors, a lot of patients are saying a lot of things about marijuana, but as it stands right now, it's just not something that we can use here in Texas. Certainly people are traveling across state lines to get treatment for rare illnesses, which is what I think Dravet syndrome is. They don't have a lot of personal problems with it or any type of knowledge about this particular syndrome. So it's very rare. And a lot of times when there's not a lot that the medical community has, they normally will go for something alternative such as medical marijuana. Again, something that a person decides to do, just like some of these alternative therapies we mentioned during the first segment.
Okay. My son has had a stopped up nose for the past 2, maybe 3 years. He hasn't been able to taste right, much less breathe through his nose for some time. We've tried nasal sprays, decongestants, allergy meds, pretty much everything. What should we do?
It sounds like they need to get an ear, nose, and throat doctor involved, and they may have already done that. Normally when a person doesn't respond medically, maybe there's something anatomical that's causing that, a narrowing of stenosis. We've talked about on this show, there's new procedures out there that ear, nose, and throat doctors perform to open things up. There may be other medical conditions, immunological conditions that concentrate on the sinuses that cause chronic inflammation, and there's blood work that needs to be done to figure that out. Sometimes biopsies are performed. Certainly ear, nose, and throat, and maybe some surgeries necessary in this person.
Okay. What would make a 77-year-old woman her feet start hurting when she tries to walk? Bless her heart.
Yeah, a lot of times arthritis, the musculoskeletal system, the joints, the muscles wear down as we get older, unfortunately, especially if this person is overweight or has some diabetes or other chronic medical problems. So probably arthritis in the joints, tendonitis in the feet of the joints, and a lot of times we can treat that with anti-inflammatory medications, maybe shoe inserts we call orthotics, and a good consultation with a local podiatrist.
Okay. This person is constantly itchy. Could it be dry skin? If so, is there something that can help besides a lotion?
Could be dry skin, absolutely. The most common cause of itching is dry skin, especially in the winter months. So get a good lotion that you like, that lather up very briskly, especially after taking your shower or your bath. But certainly look for metabolic problems, liver being one, medications, side effects being another. The cholesterol medicines, the diuretics are known for that. Immunological as well as hematological illnesses, leukemia, lymphoma can sometimes present with itchy skin. So certainly if it doesn't go away with lotion, get into your healthcare professional for a full workup.
All right, Dr. Levine, as always, we appreciate you coming in, especially on your day off, even though you're not really off.
Yeah, I love it. 24/7.
And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.